How do some advanced pancreatic cancer patients defy TNM staging odds? Imagine hearing that your pancreatic cancer is in an advanced stage and expecting a grim outlook, only to find out that some patients beat those odds. How is that possible? Well, the answer lies in understanding the limitations of the TNM staging system and the many factors that influence outcomes. The TNM system classifies pancreatic cancer based on the size and extent of the tumor, whether it has spread to nearby lymph nodes, and if there are distant metastases. But it mainly looks at the anatomy of the disease, not how aggressive the cancer is or how it responds to treatment. That means two patients with the same stage might have very different experiences. One reason some patients do better than expected is that imaging and clinical assessments can sometimes overestimate how much the cancer has invaded. After treatments like chemotherapy or radiation, tissues can become fibrous or inflamed, making tumors look worse on scans than they really are. This can lead to patients being classified as unresectable or more advanced than they truly are. Interestingly, some tumors initially deemed inoperable can become removable after chemotherapy, especially with newer regimens like FOLFIRINOX. When surgery is possible, removing the tumor completely can significantly improve survival chances. Another key factor is tumor biology. Not all pancreatic cancers grow or spread at the same rate. Some have genetic mutations that make them less aggressive, or they might have a microenvironment that slows their progression. These biological differences are not captured by the TNM system but can make a big difference in how a patient fares. Additionally, a patient's overall health, age, and ability to tolerate aggressive treatments play a crucial role. Those in good health can often undergo more intensive therapies that improve their outlook. It's also important to recognize that advances in treatment have changed the landscape. Combining surgery, chemotherapy, and radiation tailored to each patient can sometimes turn a dire prognosis into a more hopeful one. Clinical trials and supportive care options can further extend survival and improve quality of life. While statistics show that the 5-year survival rate for metastatic pancreatic cancer is very low, individual cases can defy these odds because of the unique interplay of tumor biology, treatment response, and patient factors. In summary, the TNM staging system is a valuable tool but doesn't tell the whole story. It focuses on the physical extent of the disease but doesn't account for how aggressive the cancer is or how well it responds to treatment. Some patients with advanced disease can experience better outcomes because of tumor biology, advances in therapy, and their own health status. This highlights the importance of personalized treatment plans and ongoing medical evaluation. Always remember to consult healthcare professionals for advice tailored to individual circumstances, as each case of pancreatic cancer is unique.